largest public sector trade union in Barbados is considering what course of action it will take to address the adverse impact which the new COVID-19 safe zones will have on its members in the healthcare profession. In addition, Acting General Secretary of the National Union of Public Workers, Richard Green, said on Monday the union was disappointed at not being formally consulted on the implementation of the zones, which he says will change the terms and conditions of employment for healthcare workers. We will now have to look at the courses of action that we will have to employ to address whatever areas of concern that the workers in the health sector would have with it now. It would be premature to say what action. But Mr. Green, didn't you hear that they were doing this all the time? I mean, is this you're just hearing about this and you're just planning? He says what the safe zones have done, they have altered the terms and conditions of employment of the workers in the healthcare sector in the sense of mandating the workers to take the vaccine and have compulsory testing. So that is our main area of concern, they say. And the fact that there has not been the adequate level of consultation on that change. Isn't that familiar? When Prime Minister Mia Mottley, this is the NUPW saying, when Prime Minister Mia Mottley first announced safe zones in mid-October, she promised that there would be meetings with the business community and labor union to see how safe zones could be created for patrons. Doesn't this sound familiar, Barbadians? This is the same promise that was made, that there would be consultation and there would be referendum and all of this. Read the same with this republic that is going to happen in 2 weeks, and the people have once again been ignored. And again, these unions claiming that they have been ignored because the doctors are saying, I'm hearing that over 90-something% of the doctors are totally against the safe zones. They have taken their oath, they call it Hippocratic oath, and it goes against that, and they're against it. They're finding patients, their patients are not, you're canceling appointments, which is so good. I'm saying to people, find doctors that are going to take care of you. Find doctors who are inclusive and saying all are welcome. Find those doctors and support them, and because people are you know, not going to these doctors, so they're getting concerned. So later in the program, we're going to chat a little bit about that.